started, I just want to make sure I have the right patient in front of me. Can I get a name and date of birth?
Justin Torres, May 30th, 2003.
That is correct. So if you just kind of care for the PTA record, Dr. Anthony Collins, and some exercises, walk a little bit, just monitoring your heart values and things like that. Does that sound okay? Okay, great. And before we get started, can you tell me where you're at right now?
Take care of hospital.
Okay, and do you know why you're there today?
Just to see some physical therapy.
Got it, okay. Okay, and do you know today's date?
I think it's Friday.
Okay, Friday the 27th. Okay, sweet. So I just want to get some pain levels today. How are you feeling? How's your pain today?
I have like some pain on my right shoulder.
The pain on the right shoulder? Okay.
Feels like it's
If I had a scale here from 0 being no pain, 10 to be when you go see the doctor right now, how would you feel? How would you
it's
feel?
like a 5 out of 10 right now.
Like a 5 out of 10?
It just feels kind of sore and tight.
Sore and tight?
Yeah, kind of like a teaching pain.
Like an aching pain, okay. That's great. That's good to know. So what we're going to start with today is, I just want to know, have you had any medications today? I see you had some medications. Did you take any medication today?
Yeah, I believe in respiratory.
Okay, so you took all your medication as far as you're aware? Okay, great. Okay, so we're going to start by putting on some socks for you, and then we'll go ahead and then we're going to go ahead and do some assessments here before we get started. Does that sound okay?
Yeah.
Okay, fantastic. So we're going to go ahead and let me find you some socks here. Socks is what you need. Which one? that? Let's see. Oh man, okay. Let's see. And it doesn't even stay straight.
Are you recording like that before?
No, but I mean, it's fine. I can just fix it. It should be fine like that. Yeah. There's nothing else I can do. Okay. So we just monitored your values for PT. Monitored your blood pressure, and now what we're gonna do is we're gonna do some range of motion and here. So what we're gonna do here. We're gonna do your shoulder, your right shoulder. Okay. Now for the EMT of the shoulder, what I want you to do is you're just going to raise your arm all the way up as best you can. Okay, beautiful. Okay, as far back as you can. The big is now 3. Okay, and then I'm going to go ahead and apply some resistance now. So you're going to come up, very good. And then apply some pressure. Now, and good. So what I'm going to do is we're going to do a test here with your, actually we'll do it with your, we'll do it here with your right ankle. Okay. Here. Okay. And your right arm extremity. So what I'm going to do is I'm going to put your leg in a position, okay? I'm going to grab the foot, okay? We're going to go up. I want you to have your eyes closed, okay? As we do this, but this is going to be up, okay? And when your legs relax, this will be neutral, okay? This will be in the middle. And then this will be low, okay? This will be lower. So in each position, I want you to tell me what the position is in, if it's high, if it's in the middle, or if it's lower. Okay, go ahead and close your eyes. And what position is this in?
Up.
Good. Okay. What position is this in?
Down.
Again?
Neutral.
Yeah. Okay. And then next, we're gonna do some mobility, okay? Okay, so for our head mobility, we're gonna do some, I'm gonna do some some supine to sit, okay? And so what we're gonna practice on is we're gonna practice just doing our training going from our, to our strong side, okay? So we're gonna go to our left side and we're just gonna roll here. And we're gonna practice those rolls for a few repetitions, okay? Okay. And actually, before we start that, we're gonna do some ankle pumps here. So what I want you to do is, with just the right leg, I want you to pump your ankle all the way up, okay? And then I want you to pump your ankle all the way down, okay? I want you to give me 10 repetitions of those. So go ahead and bring your ankle up and down. We'll just focus on the right ankle, okay? Good. Beautiful. We're gonna do 10. We're gonna do 2 sets of 10. When you're done with 2 sets of 10, you can let me know. Good job, that's good. Okay, beautiful. 2 sets or just 1 set? Okay. Whenever you're ready, you can go ahead and we're gonna do the next set as well. Good, yep. Focus on your breathing here as we kind of go through these exercises. Beautiful. Okay. Now from here, now that we've done ankle pumps, we're gonna go ahead and focus on some balance, just some training here. So what we're gonna do is we're gonna go ahead and bend your knees here. I'll get to this one first, and the other. Okay, and then we can go ahead and cross your arms for me. Beautiful. And then from here, we're just gonna focus on some training. Okay. I just want you to focus on being able to roll your knees one way. Okay, and then we're gonna roll towards me, and we're gonna lay on our side. Okay. So I'm gonna help you come across. We'll go 1, 2. And on 3, we're gonna roll. Beautiful. And that way, yep. Good. 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 Yep. And then we'll roll you back. 1, 2, and 3. Beautiful. Okay. We're gonna keep these knees bent so that way they can help us through this process. Okay. Good. Okay. That's 1. We'll do 5. Okay. 1, 2, and 3. Good. Yep. Beautiful. And then we'll roll you back. 1, 2, and 3. Beautiful. Good. That's 2. 1, 2, and 3. Beautiful. That's 3. And roll you back. 1, 2, and 3 here. Beautiful. Good. There we go. One more. 1, 2, and 3. Beautiful. And we'll go ahead and do it again. 1, 2, and 3. Beautiful. Great job. How you feeling? A little tired? Yeah. A little fatigued? Yeah, we fatigue quite a bit. That tends to happen, which is very common and very normal. Okay, we're just going to do 1 set of those. Okay, and then from here, what we're going to do is we're going to jump into our next exercise here. I want to go ahead and we're going to do it at the edge of the bed here. I'm going to grab some tools here. Go ahead. And now we're gonna have you roll down onto your side. Now we're gonna lift you up, okay? So here we go. Ready? 1, 2, and 3. Beautiful. Okay. From here, I'm gonna go ahead and wrap my hands around, and we're gonna lift you up. Okay? Okay. Ready? There we go. 1, 2, and 3. Beautiful. Okay. Go ahead and have your hands at the edge of the bed here. Now I'm gonna go ahead and lower the table so you have your feet on the ground. And then I'm gonna go ahead and put a gate belt on you. Good. That way we have our feet nice and flat on the ground. Beautiful. Okay. Wrap this around you really quick if you don't mind. Good. Too tight here?
A little bit tight.
A little too tight?
A little bit tight.
Oh, you can go tight. And now what we're gonna do is here, I'm gonna get you this little here. We'll go ahead and have the walker with you and for you. And what I want you to do is we're gonna actually do some we'll do some lateral raises first. Okay. So what I want you to do is I want you to lift your legs up here for me. Good, just one at a time. Just one leg at a time. So we lift this right leg. Okay, just like that. And with your right arm, I want you to grab this band, okay? And what you're gonna do is you're gonna have it over the top here, okay, just like that. And you can have this left hand on the table, okay? That's a strong hand. And what we're gonna do is we're gonna raise this arm here, that right arm, and we're gonna raise it out to the side, and we're just gonna bring it out to our side, okay? Shoulder raises. Go ahead and lift up. Good. Yep. 2. You're gonna do a total of 10. And relax, okay? Fatigued at all?
Yeah, still tight.
Okay, good. You go ahead and take a second. It will take 30 seconds of a break, and then we'll go ahead and go again, okay? Good. 15 seconds here. Okay, you go ahead and go again. Just let you come all the way down. Yep. Good. That's 10. Go ahead and relax 30 seconds. And then we'll do one more round. Another set of 10, and then we'll go ahead and get you to our next exercise. Good, and go again. Like that. Good. Go ahead and relax. Okay. Take a break. And then we're going to jump into our next exercise here in a second. Okay. Okay, our next one here is going to be a sit stand. want you to, we're gonna do, actually here, what we're gonna do is, I want you to do an isometric. So what we're gonna do here is actually with the left arm, you're gonna hold the table here. Okay, you go ahead and hold the table. Okay, and then from here, what I want you to do is we're gonna lift your arm straight out and forward, okay? And then I'm gonna go ahead and apply resistance in each direction. I just want you to fight me, okay? So here we go. Ready? Go ahead and lift your arm up. Good. Okay, I'm gonna just apply resistance. Don't move in either direction. A couple seconds here. Relax. How's that feel?
Good.
You good? A little challenging?
Yeah.
And we're gonna go again. Ready? And then go. Second. And relax. Great job. Okay. Good. Go ahead and hold that table there. Okay, we're gonna do some quick stand here. And focus on the leg. Just trying to get you up and going. Okay. So from here, we're gonna go ahead and have both hands on this walker here. Okay, right on the top here. Yep. And then what we're gonna do is I just want you to stand up using both legs. Okay. We're gonna do 10. Okay. When you're ready. 1, 2. You're gonna just sit up. Good. That's 1. Okay. And then go ahead and come back down. Good. And actually on this next one, what I want you to do is we're gonna actually test your balance first. So I want you to go ahead and have your feet together here, just like this. Okay. And I just want you to hold that for 30 seconds. Okay. Ready? And up. Good. Go ahead and put your feet together. Good. Try not to hold the bars there if you can, and then we'll go ahead for 30 seconds. Okay. If you feel like you're falling, you can go ahead and put your hands on the thing there. Okay. Good job. Last couple seconds here. You feeling okay?
Yeah.
Good. And relax. Go ahead and sit back down for me. Okay. Good. How you feeling there?
Good. A little busy, but good.
A little dizzy? Okay. Go ahead and have your feet on the ground, okay? We're gonna do some sit to stands here. So now I just want you to come up and come down, okay? Ready? 1, and 3, go. Beautiful. We're gonna do 1. Okay, we're gonna do a set of 10.
Yeah.
Beautiful. Good. Keep pushing those heels through the ground. Try and stand straight up. Try not to lean so far forward. Beautiful. Yep. Breathing in through your nose, out through your mouth. Good job, Lucas. Got 10? Good, good. Go ahead and relax. You can go ahead and you can have a seat. A little tired?
Yeah.
Okay. Make sure you keep your hands on the walker here. Okay. more set, okay? Here we go. Ready? And go ahead. Six. 7. 8. 9. Last one. And 10. Beautiful. Great job. Okay, you go ahead and have a seat. Okay, I'll give you another 30 seconds of rest, and then we're going to jump into our next exercise, okay? Okay. And then next, what we're going to do is, we're going to move one here, okay? I'll put one on this side, and I want to put one on the other side. Okay, and then what we're going to do is we're going to do a little bit of walking now, okay? And then as you're doing that, I want to remind you to keep that ankle going up as we kind of go through, okay? And I'm going to be helping you as we kind of go along, that I want you to be able to lift that leg up and proceed forward, okay? Try not to have your foot drag at all or anything like that, okay? Or foot drop, okay? Make sure we're taking nice big steps as we go along, okay? And I want you to step, each step that we go, we're going to put the walker out in front, right leg, and then step to it, okay? Here we go. So, go ahead and have your hands up on the walker here. And we're going to help you up. And then we'll go to your, actually we'll go this way, you'll go to your left first. Ready? 1, 2, and 3. Beautiful. And then we're going to go ahead and go to your left. Beautiful. Good. Okay, and we're going to walk in. Yep, right foot, then good foot. Good. Okay. Right foot, then the left foot. That's beautiful, Justin. Great job. Okay. Make sure you're keeping your core engaged, keeping that foot. Get a nice big step so we can clear that foot through. Beautiful, okay? Good. Good, yep. I want you to get that foot up nice and high, okay? Beautiful. Again. Beautiful. There you go, Justin. Great job. Yep. Good. Try and get that knee up and that foot up. There you go. Beautiful. Good. Okay, now we're going to turn to our left. Beautiful, beautiful, yep. Great job, Justin. Good, now from here we can turn. Good, those are beautiful steps, nice good steps there, okay? And make sure we have our posture nice and upright, alright? Beautiful, yep. And then what we're going to do is we're going to turn left, okay? And we're going to go ahead and get our bottom to the table. Okay? Nice small steps, good. Okay, go ahead and have a seat for me. Good, okay? I'm just going to check your vitals really quick. Make sure you have your hands and feet on the table here. Okay, I'm just going to check your heart rate. Beautiful. check your blood pressure now. Okay. Try and have your feet on the floor for me. Okay. Beautiful. Okay. Put your vitals down. Okay, I'm gonna go ahead and sit you back down. Good job, Justin. Okay. We're gonna move the walker now. You go ahead and have your hands on the table. Okay. We're gonna go ahead and we're gonna lay you back down now. Okay. So I want you to have cross your arms for me. Up. We can take off your gait belt. Fantastic. Okay. Now we're gonna go ahead and have you cross your arms for me. Make sure your feet are nice and planted. Okay. And we're gonna lay you back down. Ready? 1, 2, and 3. Good. Okay. And from here, I want you to have your head on the pillow, nice and rested. You're gonna keep these knees bent, and then we can go ahead and lift you back onto your back there. Beautiful. Okay. I'm gonna have you just scoot over just a little bit. Fantastic. Beautiful. You can have your arms laying at your side now. Okay. I'm gonna have this back again. Okay. And then next, what I want to do is I'm going to test your MMT first. I want you to go ahead and just raise your shoulder for me as best you can. Beautiful. And relax. Okay. And we'll go again. Ready? And got resistance. 1. Beautiful. Okay, great job. And then now we're going to go ahead and test your range of motion on the other side. Have your arms back to that side. Over here. Right here. Okay, go ahead and when you're ready, go ahead and raise that shoulder for me. Beautiful. Beautiful. And relax for me. We got 112 degrees after that. Okay, Justin. That'll conclude today's treatment. I appreciate you working with me. Do you have any questions before we get up out of here? Okay, fantastic. It's a pleasure working with you today. Please be sure that as we're doing this training, you keep up with your exercises when you do have time to do them on your own, especially going home and doing it at a home setting. And then I also want you to remember to focus on that bed training that we did, that bed mobility where we're rolling on our side and keeping our knees bent. That way you can continue to focus on that when you're doing anything getting out of bed, or when you're doing a transfer to, when you're getting up from a supine and laying position into a sitting position. Is that okay?
Yeah.
Okay. It was a pleasure to meet you, and you have a great rest of your day.
Thank you.